And to reiterate, the most important number for Central New Yorkers is 0. There are no confirmed cases in any local county.
And tomorrow or perhaps Wednesday, we do expect results back for a patient tested at Crouse Hospital. News Channel 9's Andrew Donovan. He's live at the hospital for us tonight. Andrew, what do we know about this patient?
For the patient's privacy, we weren't told much, but doctors here feel the chances that these tests come back positive are very low chances, because this patient doesn't have that suspicious travel history, traveling to the 5 countries at high risk, and this person isn't known to have been in contact with anyone confirmed to have the virus. At only 2.5 years old, Crouse Hospital's emergency department is the newest in town. Tonight, the doctors and nurses there treating this specific patient are wearing masks and gloves in the off chance the person has coronavirus. A sample taken this morning was sent to the state's Wadsworth lab in Albany for processing, as the patient stays in an isolation room, which is pumped with its own air supply to protect the rest of the hospital.
Ryan, what can you tell us about the pending case at Crouse?
I don't think there's much to really tell, Andrew. I think we got a case where a doctor, we have a patient who has some symptoms. The doctor's doing their diligence and saying, you're somewhat symptomatic, and let's get you tested.
The county executive says the decision to be tested ultimately lies with the person's own doctor, following guidance by the CDC. But he isn't going to be alarmed by cases that are only pending.
There's no point in talking about and breaking down information on negative tests. That's a nothing burger. It's somebody who's just got sick. But once we have a positive test, that changes things.
Before that point, SUNY is calling off international trips, and Syracuse University is advising against even domestic travel, concerning to families who had their own plans for an upcoming vacation.
Everybody's giving out good guidance, giving out good counsel, but let's get there before we worry about April 4th to 11th or whatever the days of vacation are, and look at where people are talking about going. Certainly if you had a spring break cruise that you're looking to get on, probably not a good idea.
The process for hospitals and local doctors seems to be changing almost daily. At this point, hospitals do testing in coordination with the state health department. They do not need the blessing from the local county health department to test a patient. Live in Syracuse, Andrew Donovan, News Channel 9.